Hi, I'm Dr. Mike Milligan. I'm here with Dr. John Comisi of Ithaca, New York, Speaker of the House of the American Academy for General Dentistry. But right now we're going to talk about balanced oral environment. John, thanks so much for being with us.
Thank you very much, Mike. It's great to be with you.
What do you mean by a balanced oral environment?
Well, when I'm out on the road and I'm speaking to other docs about mouth care, health care for the oral environment, we have, our patient population is being inundated by the commercialism of a lot of over-the-counter agents, right. Toothpaste, rinses, et cetera, and so forth, right. All touting to be helpful and beneficial. Yeah. The reality, though, is that as we continue to look at the science, some questions are starting to come into play, right. As to really how effective and how helpful are these various agents. I personally, every new product that comes out, I personally try, right. Just to see what happens with it. Right. And various agents over the course of the years have created all kinds of issues in my mouth, as it does in a lot of folks. And they're not aware of it because the commercials tell us, this is good for you. Right. But the reality is when you use it, if you have a burning sensation, if you have any kind of sloughing of tissue, maybe you really shouldn't be using those agents. Right. One company that I went to a key opinion leader meeting with, about 30 other healthcare professionals in the oral environment. We were there, and the various people from the chemistry departments came in and talked about what their products can do to virtually give a patient a clean mouth. Right. And they asked for a raise of hands of how many people in the room are using that product. And everybody in the room but me raised their hand. So they looked at me kind of strangely and they asked, why don't you do that? And I said, because it burns the heck out of my mouth. Yeah. And it makes tissue sloughing. And the scientist turned without missing a beat and said, it's supposed to make your mouth burn and your tissue slough for about 30 days. And I said, so in other words, you're giving me a sunburn in my mouth that's going to eventually potentially create a problem, right. In the soft tissue lining. Right. So we don't recommend a lot of the OTC products at all. Right. Additionally, some of the overall chemistries that are present there, some interesting articles in Journal of Dental Research talk about the acquired enamel pellicle and how delicate it is, and how the influences of what its environmental factors can enable it to either enable health in the oral cavity, right. Or disable right. The healthy environment. Right. So are these chemicals and these agents, are these things creating a pathogenic circumstance where it could be a healthy commensal situation? Right. And are we changing our bacteria from good, healthy situations into zombies?
Could be.
Yeah. So we don't know, and that's the protection that I want to try to establish for our patients.
What are some of the things that you do like to use?
We like to recommend products that contain xylitol. Right. We love to recommend probiotics of various types, products that are high in calcium and phosphates, because you need calcium and phosphates for tooth remineralization. Right. You can't have remineralization, of course, without some acidic environment. But you can't have a prolonged acidic environment because you're going to continue to remove the minerals rather than enabling a pH balance to be reestablished and calcium and phosphate intake into the dental tissue. So balance is right. Key in the entire thing.
The acidic environment also lets the bad bacteria thrive, and as opposed to having the good bacteria thrive in a less acidic environment.
Exactly.
Course, so much of what people eat and drink now causes that acidic environment, the soda pop. And
there's even some interesting information in that certain waters in our bottled waters are more acidic than we would have ever imagined. Right. And that's really one of the shocking things. So for people who have an acidic mouth, right. They don't like the taste of water. Interestingly enough, because it tastes bad. So there are a couple of things that you can do. Twice a day in a bottle of water, put a package of xylitol. Sure. In there, right. And have that in the morning and in the afternoon. That gives you about 8 grams of xylitol, which is therapeutic, because you need 6 grams per day over the course of the day to be therapeutic. Right. 8 grams, 4 in the morning, 4 in the afternoon. Right. What a great easy way to hydrate. Right. Another thing, baking soda. People brushing with baking soda is a nice way to balance the pH and also help to get rid of that acidic taste. Yeah. It's a really easy, remarkable way to do things.
Great. Give us some more.
Oh, goodness. Again, the probiotics, I love probiotics because that also is helping because you have a friendly bacteria competing with the pathogens for the same food substance. And if you have more of the good versus the bad, you're going to be able to starve the bad bacteria and establish a more healthy environment in the oral cavity, both for reducing decay and also helping to control periodontal disease.
So you're bringing in the extra troops with
Exactly.
the probiotics to help fight that battle against the bad
The
bacteria.
cavalry can arrive at that point in
Right,
time.
right.
Exactly.
Reinforcements.
Yep. Anytime you can get it. Because, you know, the reality is that some environments are just going to be continually challenging to the protective aspects of the oral cavity. So if we can give them extra help with xylitol and baking sodas and probiotics and other things like that.
Things like Carefree as well.
Yes.
Wonderful products.
Good products. Excellent.
Wonderful.
Great products there. There's a lot of wonderful outside of the box capabilities out there.
Right.
You just have to do the research. You have to look at what's going to work and how you can basically incorporate it into your day-to-day practice to enable your patients to not only tell you that they're doing the job, but actually showing you that they're doing the job,
See
which
it
is
on
the
the
key.
results.
Indeed. Yep.
Anything else you'd like to tell us before we close here, John?
I just try to help your patients understand what they need to do to help themselves. We're Americans, and darn it, we want it easy. But the reality is that nothing in life comes easy. You have to work at it. And with your dental health care professional, you can establish and help yourself stay healthier.
Great, John. Thanks so much.
A pleasure. Thank you so much.